Well, the coronavirus is in China and now being blamed for more than 1,000 deaths. This is more than the SARS epidemic in 2002 and 2003. CBS News chief medical correspondent Dr. Jon LaPook joins us now live from New York to try to put this into perspective for people living here in the United States and more specifically in Minnesota and Wisconsin. So what do we know about this virus so far, Doctor?
Well, again, to put it in perspective, more than 99% of the cases have been in China. They're having a heck of a time there. More than 42,000 cases and over 1,000 deaths worldwide. But in the United States, there have been 13 cases. So again, when you compare that to the flu, where there have been about 20 million cases and about 12,000 deaths and 210,000 hospitalizations, it's nowhere near as deadly or as much of a problem as the regular influenza virus. So that first. In the United States, we have a very robust public health system. What does that mean? It means if somebody here gets infected, hopefully we find them early, we diagnose them early, we isolate them, and then we with just shoe leather, we can't figure out who are their contacts, and we follow them closely or even quarantine them. So I think for the average American here, the risk is quite low.
So far, we've seen one case reported in Wisconsin. No cases have been reported here in the state of Minnesota. But you mentioned the flu and how that is something that we need to pay attention to. But should people be watching out for symptoms of the coronavirus, and what exactly are they?
Okay, so yeah, always, one of the things the public health officials are telling us is, yes, there are only 13 cases now, but this is a fluid situation. It could change, so they're all over it. They're watching this. The symptoms are very much like a common cold or even an early flu. So you can have a headache and cough, fever, and then where it starts to become a warning sign is if you get shortness of breath. When people do get symptoms like that, one of the first things you do, because I spoke to a public health official and I said, what are people supposed to do? When do they go to the emergency room or their doctor if they get these kind of symptoms? And he said one of the things is to do a risk assessment. If you're getting the symptoms, have you been to China? Have you been exposed to somebody who has been to China or who is at high risk for some other reason? And so that helps put it in perspective. Of course, you want to talk to your healthcare provider, but any of the people who I've spoken to who are in public health are saying, in terms of wearing masks around the street, if you're not at high risk, you're not in a high-risk area, there's really no reason to do that. And the regular masks that we have, they really only give partial protection, if at all. Well, may give some protection in terms of the coronavirus, because remember, that virus is 0.1 microns, very, very tiny. It could go right through a mask. But since it's spread through particulate, it's little droplets, and then you cough them out, and the virus is in the droplets, the mask may help catch that.
In terms of how lethal the virus is, how deadly it is, where do you compare it to other viruses that have spread? Ebola, the flu, where does it fall along those lines?
It's actually more along the lines of a bad flu than something like even SARS or MERS. So in 2002, 2003, mortality rate for SARS around 10%, for MERS much higher, about 30%. So far here, there have been 42,000 cases, and the mortality rate is a little over 2%. And it actually may be a lot lower because there may be a lot of cases that are asymptomatic, either very few symptoms or maybe even asymptomatic. So it may turn out the mortality rate is more along the lines of like 0.2 or even 0.1, which are like 1 in 1,000. It makes it along the lines of like a bad flu.
Okay, well, Dr. Jon LaPook,
the best things that people can do is get the flu shot. Get the flu shot. If you're worried about it, please get the flu shot. That'll help decrease any kind of this anxiety about, oh my gosh, I have symptoms, and it turns out to be the flu. Should have lowered the risk of that being an issue.
Well, thank you so much for your time and your expertise. We appreciate it.
Nice to talk to you. Take care, Allie.